Hi, this is Steve Adubato coming to you from the campus of NJIT, that's the New Jersey Institute of Technology. Why are we here? This is, in fact, the Voice Summit, sponsored by Amazon Alexa. You've got about 2,500 folks from all over the country, programmers, people involved in something called artificial intelligence, all about voice. What does voice mean in our lives today? What could and what will voice mean in our lives tomorrow? That's what the people are here talking about at NJIT at this Voice Summit. We'll be interviewing those folks and bringing everything you've ever wanted and needed to know about voice to you right now. Jennifer Warren, senior editor at the Mayo Clinic. By the way, tell everyone what Mayo Clinic is all about.
Well, we've been around for, I don't know, maybe you've heard of it. We've been around.
Pretty good brand and reputation.
Right, well, and we've been around for over 150 years, and we really see our reason for getting into voice is that we've always put the needs of the patient first. And so throughout our long history, we've always evolved in different ways to get information and healthcare to people where they are and when they need it most.
Let's talk about that a little bit. Because so many people are going on the internet to try to get information, if not diagnose what they think is going on, how is this different?
Well, we've developed several different voice-activated, voice-enabled initiatives. We have those directly facing patient care. I work with ones facing consumers, so if you ask Alexa or another voice-enabled device, you know, what is diabetes, how is this treated, you can get trusted first-party health information.
What do you mean first-party? Break that down.
Well, that's something new that we're working with various, voice-enabled device producers, and we're working to get more and more of our content directly to the consumer, so you're not just getting a web-based search result, so you know where the information is coming from, so you can rely on that information. And also we have a Mayo Clinic first aid skill for Alexa, so you can get that skill, and that addresses about 50 of your most common things. You get a cut or a scrape or a burn, or your child has a fever, and you can get that same trusted first-party, Mayo Clinic information to guide you where and when you need it most.
What are most people looking for?
They're looking for trusted health information. You can get information anywhere, but where can you get Mayo Clinic information? And all of our information is sought after because it's trusted, it's evidence-based.
It's coming from the Mayo Clinic.
And it's physician-reviewed by the Mayo Clinic experts, so you know that it's reliable and trustworthy.
How'd you get into this?
Oh, I've been on this content ride for a long time. I started off in print at Time Magazine, and then ABC News and CBS Health Watch.
Why do you call it a content ride?
Well, because I've been in this business for 20 years, and we've evolved from,
We're in the
print.
content business.
Yeah.
Someone says you're in television. We're in the content business.
Yes.
You're in radio. You're in the content business.
Exactly.
Whatever platform, it's content.
Right.
Is content still king and or queen?
Well, we're definitely not the only hospital that has a website, but our traffic is more than all the other top 20 hospital websites together. So people are coming there, not just our patients.
Right?
Yes. The top 20 hospitals on the U.S. News and World Report, all but one of them have a website, but our traffic is more than all the other ones combined. So it's not just which says it is our content that they're coming to. It's not just our patients that are coming to our website. If you go to your local regional hospital, it's probably just their patients that are going to that website. But health information seekers at every stage of their journey, whether they're newly diagnosed, whether they're looking for a second opinion, whether they're looking for just deep information for their child or their loved one, they come to us for health information. And so it is all about our content as well.
Where do you think voice will take this whole area of consumers / patients wanting to get quality, peer-reviewed, if you will, information about their health? Where do you think it is going potentially?
Well, I think it's going to be a key market, for patients as well as consumers, and every consumer is a potential patient, in that voice-activated technology is available in your hands and your eyes aren't. It's going to be increasingly important for people with disabilities, senior citizens. I have a friend whose father has, a chronic health condition, and she's becoming a caregiver for him, and she ordered him a voice-enabled device so she can check up on him, give him prescription reminders, remind him about appointments, and as well as call emergency services if that's necessary as well. So it can really revolutionize how we interface with not only our own health information, but our providers as well.
Age matters in a lot of ways. Younger people who have grown up and in some cases been consumed by technology, how do you see their potential use of voice technology when it comes to their own health? And is it any different than for middle-aged folks and others?
Well, I think we're getting into an age where not only do they expect every device to talk to them and be voice enabled, and they're surprised when it doesn't, they also are accustomed to that constant feedback. So you see all this evolution of the wearables and wearable technology like your Fitbit. They want to be able to ask, how many steps have I gotten? What's my heart rate? If you have a condition like diabetes, what's my blood sugar? They want to have that constant feedback. And by coupling that technology of the wearables with trusted health information, I think that's going to be a real evolution for younger patients who are used to having that constant feedback. They're not used to calling up and waiting to get into their doctor for a week before they can get that feedback on, what's my blood sugar doing? What are my, how's my cardiovascular fitness? They want that feedback now.
And for older folks who may be watching and telling themselves, well, that's just not me. I want to talk to my physician personally. I want to have that human direct interaction, which is easier said than done.
Right.
What do you say to them?
Well, I say that it's the easiest interface there is. It's the first interface you have is your voice. And so at times when other things might fail you, you'll still have your voice and be able to interact with that. And increasingly their physicians are going to become reachable. People are already asking about booking appointments, via voice, getting prescription reminders, getting all these types of information, which can be a great memory and backup, and it's personable, and you can do it for whatever you
It's
like it to.
It's interesting how you say this. I was ordering a prescription the other day. I know this is an old school example of it, but sometimes if you call the pharmacy, you wait for the pharmacist, they put you on hold, you wait, whatever. Then they look it up, you'll see. Is voice technology also as simple as the prescription number, there's a refill, or you think there's a refill and you want to confirm it, and you go through the system and you put in the prescription number and it tells you, or it asks, you want to pick it up when, is that a rudimentary but very...
That's very real. I mean, it could be no different than, reordering something from Amazon. Once you have the history established and everything's specific, it could be as simple, in the very near future. It's happening in some places already where you could just say, reorder my, pain medication.
That's it.
Yeah.
And I don't have to program it in. At some point, if I do the original work.
Yeah. Once it's set up, then the recurring ask is built into a lot of these apps. Now they're becoming smarter all the time. That's the artificial and adaptive intelligence. Once they know your history, then reordering it's easy.
You're fascinated by this, aren't you? You can tell. Yeah. And you're originally from?
Minneapolis, right by the Mayo Clinic in Rochester.
Well, I'm sorry for interrupting. Great to have you in Jersey,
Great.
Especially in Newark. Jennifer Warner. Jennifer Warner is senior editor at Mayo Clinic. You may have heard of them. Thank you. Appreciate it.
Thank you.
Stay
nice
with
to meet
us.
you.
One-on-One with Steve Adubato has been a production of the CAUCUS Educational Corporation, celebrating over 25 years of broadcast excellence. Funding for this special edition of One-on-One with Steve Adubato at NJIT has been provided by Holy Name Medical Center in Teaneck, New Jersey, Valley National Bank, Delta Dental of New Jersey, PSC&G, the law firm of Gibbons, PC, United Airlines, and by the Port Authority of New York and New Jersey. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area.